is this cot stop is pectoralis minor, this one is pectoralis minor. See, this muscle is serratus anterior, which is only attached to medial border of the scapula, and this muscle of scapularis. So this is serratus anterior, only attached to medial border of scapula, but this one is attached to subscapular fossa. This is subscapularis. Okay. Then what you get over here, deltoid, very common triad muscle. Then this is your supraspinatus, infraspinatus, which are not usually asked. Okay. Now let's go to the arm. Front and back of arm are two Indo questions. Okay. So what you get here, see. Name the muscles here, biceps brachii,
brachialis,
coracobrachialis. So see this muscle over here that we can see is biceps, and I got two heads. Okay, I'm putting the forceps in between two heads. See this one that is lateral is long head, the one that is medial is short head, and the short head is in combination with the muscle coracobrachialis. See here you can find the short head, and this is in combination with coracobrachialis. How to know the coracobrachialis? It is pierced by the musculocutaneous nerve. You long head lateral, short head medial. Then this muscle is coracobrachialis in conjunction with short head, and through the coracobrachialis what is passing? This is the musculocutaneous nerve. Okay. Now when you lift the biceps, you get the brachialis. Now what are the other nerves here? See this nerve, it is having two roots. Okay. This is your medial root, lateral root. The combined root from the median nerve. How to get it? Two roots are there forming it. Okay. Then see over here, this nerve that is going behind middle epicondyle, ulnar nerve. Okay. Then see over here, muscular nerves we have already seen. Then two other nerves you need to know. See the structure over here. See, this is the posterior cord of what I am holding. From that, what I am holding is the posterior quarter-brachial plexus. From that, this nerve is going to the back of arm. This one, this is radial nerve, and this one is going to deltoid. So it's axillary nerve. Okay, so you go here. See, what I am holding with my thumb and index finger. This one is your posterior quarter-brachial plexus. From that, see, this nerve arising is going to the back of arm, radial nerve, and this nerve arising is going to the deltoid. That is axillary nerve. So these five nerves you need to know: median, radial, ulnar, muscular, axillary. Now, what else is here? The artery and vein. See, this is the brachial artery. But here, this is the axillary artery. See, when the location changes, how the iron location changes. Here is the axillary artery, but its arm is in the middle of the brachial artery. Okay. Then see this vein you can find. See, this vein. Okay. This stump is over here of the vein. This stump. Okay. See, when I am holding in axillary vein, but in the middle of the arm is basic vein. Okay. And the cephalic vein passes in the deltopectoral group, that is here. Okay. See, this is the cephalic vein, okay, that is passing in deltopectoral group. So this is pectoralis major, this is deltoid, so the group between them is called deltopectoral group, and what is passing here is cephalic vein. Okay. Basilic vein continues upward as axillary vein, cephalic vein drains into axillary. Okay. Now coming to the back of the arm. Name the muscle. Name the head.
Three heads, long heads, medial head, lateral head.
So see, this head over here, that is coming from above. This is the long head, and you can find here a head that is cut in the middle. See? This is lateral head. Okay. And here you can find these two things: the white structure, this one is your nerve, and this is the vessel. Okay. This is spiral root. So above spiral root, lateral head, that is part. Below spiral root, what is deep inside is the medial head. Okay. Long head, lateral medial head, and here they ask you to identify the vein and the nerve. So the nerve is radial nerve, and the artery and vein are profondobrachial vessels. Okay. Then the cubital fossa. Tell the boundaries. Medially, what are tails? Okay. So this thing that you get here, medially, this thing that I have put my finger beneath. Okay. That is ending here in the middle of the forearm. The pointer tails. Okay. Medial side and this brachioradial. Okay. Then you know the apex formed by fusion of the medial lateral boundary, and at the base there is imagine line that is formed by joining the two epicondyles of humerus. Okay. Now see what else you get here. The content. Okay.
MBBR.
So MBBR, here have the member. So see from the medial lateral side this median now. This one is brachial artery. Okay. Then this is tendon biceps brachii. Okay. And over here you have to retract the brachioradialis. So deep to that, what you get here? See. This thing, okay? This is the superficial branch of radial. But many people don't count it as a content of the triangle because it is under the brachioradialis. So they are the 10 tag. tendon, artery, nerve is median nerve. Tendon is present by biceps brachii and artery is brachial. This can be pose window and this cubital fossa. Settling basically being the other joints पर जो टाइप मजे रखी ना इधर median cubital है ना. Now coming to front of forearm is difficult and is asked as a window to many people. So here there are 5 superficial muscles, 3 deep muscles. So first, how to identify the 5 superficial muscles? Just like the 5 fingers. Most lateral is your pointed teres. Then medial to that, flexor carpi radialis, and palmaris longus, FDS, flexor superficialis, and flexor carpi lumbaris. Okay, so see over here. First, go to pointed teres. How to find that? Go to cubital fossa, find its medial nerve. So this one is, this muscle over here is, see this one over here. This muscle is pronator teres. Okay, and see it is ending in the middle of the forearm. Okay, then just sequence wise. Okay, so this one is the flexor carpi radialis. Then this muscle is palmaris longus. You can see here short belly, long tendon, vestigial muscle. Then this one, this multiple tendon muscle is flexor superficialis, and this one is flexor carpi lumbaris. What is flexor digital superficial? There are 2 digital muscles here. Superficial D. How to know this FDS or FDP? By the number of tendons. So multiple tendons. So FDS give to that multiple tendon but T. Profundus. FDP. Okay. Profundus means deep. Okay. So see over here. The superficial muscles are formed. Then name the deep muscles. That is flexor pollicis longus. Pronator quadratus. Then last muscle FDP. Flexor digital profundus. So see over here. This tendon is flexor digital profundus. Okay. And this tendon going towards the thumb. Okay. This should be one here. So this is going towards the thumb. Okay. So this is flexor pollicis. It feels like flexor pollicis longus. And see this muscle, you see this muscular band. This is chronoquartus. Here you can find a muscular band. Okay. This muscular band. Chronoquartus. Okay. Chronoquartus. Now, what you need to know extra? See, this is interosseous membrane, and in front of that, 2 things are there. Here are 2 things. Right? In front of the interosseous membrane, you get 2 things. The thread-like structure is the nerve, anterior interosseous nerve, and the thick structure is the vessel, anterior vessel. See, we have seen this thing, the interosseous membrane. In front of that, there are 2 things. Since the interosseous membrane, okay. First is chronoquartus, above that the membrane. Okay. Then you see here 2 things. Okay, 2 things you can see. One is thin, one is thick. Thin one is anterior interosseous nerve. Thick one is anterior vessel. Okay. Then another thing you can show here, but I don't know whether the examiner will ask. See, this is the radial side. So here you get basically 2 nerves and a couple of structures. See, this is the radial nerve. This is radial artery on the radial side. Similarly, here you have to get. I'm coming to that. See, these 2 things. Okay. These 2 things you find on the ulnar side. So ulnar nerve, ulnar artery. Okay. Then you go to the back of the forearm. Last thing in the forearm. See, this thing is not a very commonly asked window question, but flexor compartment, front compartment asked. Okay. But you need to know the retinaculum, flexor retinaculum. So here the 12 muscles. Out of them, 9 run underneath flexor retinaculum. So you come from the lateral side, go to the medial. This is the first compartment muscle. Underneath the retinaculum, external retinaculum, 6 compartment, 9 muscles. Okay. So these 2 muscles taken together are abductor pollicis longus, extensor pollicis brevis. First compartment. Okay. Longus is lateral. Then the next compartment, 2 muscles. Extensor carpi radialis longus, extensor carpi radialis brevis. Longus is lateral. Okay. Then this is your extensor pollicis longus, third compartment. In the 4th compartment, you get 2 muscles. See, this one is extensor digitorum, and deep to that, this one is extensor indicis. Okay, digitorum indicis in the same compartment. Then this one is your extensor digitum minimi, and this one is extensor carpi lumbaris. So what is related? Three muscles: anconeus, supinator, brachioradialis. How to find brachioradialis? Very easy. Go to cubital fossa. It's lateral border. Okay, it will be formed by the brachioradialis. So how to find the supinator? Retrograde brachioradialis. Okay, there you get the division of the radial nerve into two branches. What I have proved here is the deep branch of the radial nerve or posterior rectus nerve. Okay, so that is entering into the muscle, that is supinator. Okay, or you can tell in the cubital fossa, the lower part of the floor is formed by supinator. Same, and this muscle over here is anconeus. So this one, can you find the triangular muscle? See? This muscle you see, this one. This triangular muscle is anconeus. This one is anconeus. So 12 muscles are there.